Understanding and addressing individual and group behavior is essential for teams to meet their goals and serve their patients. The AHA's Physician Alliance has interviewed several clinician leaders to understand how hospital leaders can make medicine kinder, safer, and more reliable through promoting professionalism and accountability. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Senior Writer for AHA. In this episode, Elisa Arespacochaga, Vice President of AHA's Physician Alliance, speaks with Dr. William Cooper. He is the Cornelius Vanderbilt Professor of Pediatrics and Health Policy, Associate Dean for Faculty Affairs, and Vice President for Patient and Professional Advocacy at Vanderbilt University School of Medicine.
Welcome to another podcast in the AHA's ongoing series where we focus on important issues facing clinician leaders. I'm Elisa Arespacochaga, Vice President of AHA's Physician Alliance. And today I'm joined by Dr. William Cooper, Cornelius Vanderbilt Professor of Pediatrics and Health Policy, Associate Dean for Faculty Affairs, and Vice President for Patient and Professional Advocacy at Vanderbilt University School of Medicine. And today we're talking about how hospital leaders can make medicine kinder, safer, and more reliable through promoting professionalism and accountability. Well, Bill, to get us started, first tell me a little bit about yourself and your experience.
I'm a pediatrician. I provide care for patients in our primary care clinic at Vanderbilt. I also, over the last few years, have taken on leadership roles of helping our institution and our department address faculty issues for our physicians who practice here at Vanderbilt. And about 6 years ago, took an expanded role in helping the medical center address professionalism here at Vanderbilt, as well as work we do with collaborative sites around the country.
So as you've done that work with hospitals and health systems across the country, and you've got quite a network built, what are the things that have sort of most surprised you as you've tried to work on this professionalism and increase accountability with these organizations?
I'll tell you, one of the things that has really been most surprising is how consistent the experience has been at almost all of the organizations we've encountered. The vast majority of the clinicians at these organizations, whether they're a large regional health system or a small critical access hospital, or they're an academic institution, and no matter what region they're from, what we find is that the vast majority of clinicians show up for work, provide great care for their patients, and treat everyone in their environment with respect and dignity. Very small number, however, don't always behave in those ways. And what's been striking is how, no matter where we are, no matter what we're measuring, we almost always see the same distribution.
So I guess people really are people.
You put people in a clinical setting, and they do behave in this ways, and humans are humans.
Exactly. So as part of this series of podcasts, we've talked with leaders from a few organizations that have worked with you and the Vanderbilt team, and they've taken some different approaches to how they addressed professionalism and where they've made those connections in their organizations. Can you share a little bit about some of the themes you've heard and how that's reflected across the country?
A couple of themes that I've heard in the conversations we've had with these health systems is where this engagement is most effective is when an organization approaches it from this sense of caring about not only the patients that we serve, but also about the clinicians that practice in our environments. And so if we treat those individuals and the focus that Stanford has taken on wellness of their clinicians and linking the fact that for sometimes individual professionals who continue to behave in ways that aren't necessarily consistent with our culture, it may be not that they won't improve their performance. In some cases, they can't. So helping to connect those individuals to resources is really important. And when it really works is when individual leaders and individual peers who encounter professionals who, for whatever reason, stub their toe, if they really come at this from, we really care about you as one of our team members, that has been really important. And I think that's an important theme that emerged. The other theme that I've seen is that organizations recognize that culture change is not only a long-term process, but it's a sort of an iterative process. So what has happened at Penn and has happened at a lot of our sites around the country is that when leaders remain committed to this work and take the long-term view and have trust that the vast majority of their individuals are going to respond, and that leaders who sort of continue to follow a consistent process, that these processes are likely to work, those are places where this really does take hold and begins to make a huge change and moving the needle on their culture.
Great. Yeah, I think, unfortunately, culture change is not something that's easy, but is so rewarding if you can stick with it.
Now, culture change is exhausting. We often say, this work is not for the faint of heart. And so being able to take the plunge, as long as you recognize that addressing these real challenges that we face are essential if we're going to continue to provide the highest quality care for patients who walk through the doors of our healthcare facilities.
Absolutely. I agree. I don't think this is an optional approach. So tell us, what are some of the key factors for success you've seen across all the programs? I know as you've said, you've worked with large regional systems and academic medical centers and then critical access hospitals. Are there some success factors that really span across those different settings?
There really are some factors that we see that are essential. One of the most important is that the hospital or health system really needs to have a handle on its core values and what its aspirational goals might be. So if this is a place that wants to be a world beater, recognizing that not addressing some of these challenging issues with professionalism actually gets in the way of those goals is a really essential thing. And so we find where this work is most effective is when people can say, gosh, we want to be X, Y, or Z, and these behaviors or this pattern of performance is not consistent with that and is not going to help us to get there. The other factor that we see that's really important, or another factor, is leadership engagement. Leaders at the highest level and leaders at the front line need to, one, connect to those values and be willing to hold each other and their colleagues accountable. Leaders have to model respect. Where this works is that the leaders have to be seen as individuals who treat those on their teams and those throughout the hospital and health system with respect. It has to align with the other things that are going on in terms of there has to be the right systems in place for identifying data and addressing and following some model and using the right tools and processes to address the very small number of individuals who behave in ways that frankly just get in the way of what we're trying to do for our patients.
I agree. I think that last point you made is particularly important in the work I've seen, just being involved in some of your programs, is the need for a consistent process and data. I don't think you can overstate having that level of understanding of what's going on in the field really helps get everyone on the same page.
I think you're right. The data are really essential to this. And oftentimes what we'll see is that not only are data helpful for the leaders, but they're helpful for that individual professional. I can think of an individual that I ran across in my work as a peer messenger, sharing performance data on professionalism issues with one of my colleagues here at Vanderbilt. And when I talked with them, they sort of said, look, I had no idea that I came across this way. I always thought that I was really, advocating for my patients. But now that I see where I sit relative to other peers, it's like, oh, I kind of get this. And I never really thought that it was a problem. So those data can really be a powerful guide and signal that behavior change may be needed.
Absolutely. Can you share some of your reflections, having done this now for quite a number of years, on the impact that these programs are having on the institutions you work with, both at Vanderbilt, where you see it firsthand every day, and then at all of the other organizations that you've been partnering with?
The original work that our center was founded on was identifying and addressing malpractice claims risk for physicians. And so over the years, we have measured the impact that work in professional accountability has played placed in the context of many other things that hospitals and health systems have done to reduce their malpractice risk. But based on our randomized controlled trials, we've seen that professional accountability does have some element of contributing to savings in malpractice, and some of our sites have saved millions and millions of dollars in what they would have been expected to have spent on malpractice claims and what they actually experienced, even when we work with actuaries to address market changes and other factors that may be affecting savings. The other thing we hear, and this is what we hear often from senior leaders at some of our longer-standing sites, is they're able to point to this use of tools and processes for professional accountability as a turning point for their culture. That this is how we would want to be treated, and this is how we want to treat our colleagues. And that is a really key part of saying, it means something to work here. And when we do this in the right way, we not only help to address, 80% of people, when you bring these sorts of performance challenges to their attention, they're going to improve. And if 80% of our colleagues can improve, what a difference that makes, not only for those individuals and the huge investment they've made throughout their careers, but also for their colleagues where they work and their patients.
Absolutely. We've seen some of these organizations really use this as an anchor to keep that culture change happening and moving forward. I think that's a really powerful way to approach it. So, what advice would you share with someone who's listening to these and thinking, well, maybe we should start something like this in our organization?
Somebody's listening who's thinking about what next steps they might take. Many times when we first engage with organizations, they're able to sort of in their minds create the list of those professionals on their medical staff who soak up an enormous amount of their time as leaders. So understanding first that there actually are challenges in the environment, and these are complex times. Healthcare is increasingly complex. But what the next step that's really important is that we believe that if for organizations that are taking this first step, really need to sit down and in a collaborative way understand what it is they want to be when they grow up. What are the values of our hospital? What are the values of our health system? And where do we see making our biggest impact? Because when you superimpose their understanding of that small number of individuals with their values and their aspirational goals, then you see the importance. And that begins to be, those aspirational goals are sort of the guiding point for why we do this. And then having a chance to understand, well, what do we currently have in place in terms of the right people and leadership and people who can move this work forward? What do we have for our processes and what data systems do we have in place? And then putting in place some of those essential things to drive this are some of those first steps. But I do find that really understanding who and where and how this organization wants to make a difference is one of the most important first steps.
I'm touched by that. It reminds me a little bit of advice my father always used to give me, which was, step back. Where do you want to go? Because I'm not sure you're clear on that yet. So it sounds like really understanding where this journey should be going and not how you want to address professional accountability, but why.
Our most successful collaborative partnerships in this work are places that have a clear idea of where they're heading. And we come alongside and support their leaders in thinking through how the work on promoting the right culture is going to help them achieve those goals.
Thank you for sharing a little bit about the Vanderbilt program and the work that you've been able to do. Do you have any final words you want to share with our listeners?
Recognizing that as a leader, when I'm called on to address a colleague who may be experiencing challenges, but just like I find in my clinical work, there are things that I do clinically that may not be all that fun, but they're really important. And so recognizing that, I think, it has been one thing that has been helpful for me because this is hard work. And so being able to recognize why we do it as an important part of our contributions as leaders, I think is a really essential thing.
Yeah, I think underscores it's not for the faint of heart, but it's absolutely essential to what we do. So thank you for joining me.
Thanks for your interest, and it's been fun to talk about these things. I love talking about it.
And I look forward to sharing this with our community.